Hello, good morning, Dr. Doni TV lovers. Today we want to talk about what is drug resistant and why you have been taking a lot of drugs and you found out that these things seems not to be working. Okay, Emeka, I just want to ask you, when last did you check yourself? When last did you go to lab for, to do your malaria parasite test? And again, when last did you go to a nearby chemist to buy drug? Just because your mouth was bitter, you're having headache, and you just went to buy drug. All right? No, you need to see your doctor because it has been said that people who consume a lot of drug are a tendency to have a drug resistant. Now, simply put, what does drug resistant mean? It means that there are bacteria in your system that are actually growing. Now, when you take an antibiotic that are meant to fight this bacteria agent, the antibiotic does no longer work again. Okay, now by resorting to this malaria to keep growing, they're making it difficult for you to treat yourself whenever there is maybe sepsis and so on. Okay, now according to World Health Organization has recommended that a combination therapy is the only form to treat malaria. Do you know about that? Have you asked your doctor this question? Do you just go to chemist store and buy drug and start treating malaria without you going in for investigations first? Now, when they said that the only combination therapy is the artemisinin combination therapy. Yes, the artemisinin based combination therapy that contain about 3 components. You have the artemisinin inside, you have the artemether, those are the components, and you also have dihydroartemisinin, that is also one of them. Okay, now if you keep taking anti-malaria drugs, it doesn't work. It's either that your body system has become resistant to most of these medications you are taking, and you need to check, because if your blood is cultured and discovered that yes, there is resistance, that drug needs to be changed for that stuff that is disturbing you to be corrected. Have you asked? Have you actually checked? Do you know? Or you just go by, consume this drug, and yet you still feel unwell? Now, I want to tell you today, there are a lot of things that can make drugs not to work. One of them is drug resistance. Emeka, do you know about that? When there are drug resistant, if you like, take thousands of it will not work. Another thing again is counterfeit drugs. You see drugs that did not contain the chemical component of that particular drug, but you are consuming it. It's not NAFDAC, and you feel you want to take it, you just want to take it because probably maybe it's cheap or something else, why it does not have the chemical component. Emeka, you must stop all those things, okay? Go check yourself properly, get the proper checkup, make sure you see your doctor, let your doctor evaluate you, send you for investigation, because the clinical judgment is about 75%, and why the laboratory judgment is about 30%. You put all these things together to manage a patient. All right. Do you also know that a host immune system can affect drugs not to work? Do you know that? And do you think you can just know about it? You must ask a question. Okay? So try to take drugs. Try as much as possible to stop taking drugs anyhow. Make sure that all the drugs you take are being prescribed by your doctor for you to avoid drug resistance. Because by the time this condition gets deteriorated and you needed most of these drugs, like people who abuse ceftriaxone, just because they want to treat one thing or the other, they keep taking it. By the time they got sick and they need this medication to recover, and they notice that this drug is resistant to their system, there's nothing you can do about it again. Instead, you have to change the class of the drug. So you must know all these things, because excessive consumption of drug is not right. Another thing again is inadequate dosing. A doctor will prescribe drug for you to take 2 morning, 2 afternoon, 2 evening, but you go your home, you take 1 morning, 1 afternoon, 1 evening. How do you think this drug is going to work when you're actually meant to take maybe like 1000 milligrams of it? How is it going to work? So you must adhere to the instruction of your doctors for anything you're taking to be effective. Thank you. We will bring you more on this. Dr. Doni TV love you. Have a lovely day.